let's kick off. So what I'm going to do is I'm going to just spend a few minutes talking you through our program and our rationale for creating this program, which we've been working very hard on over the last 6 months. And then we'll open up to Q&A, and we'll give you a chance to answer loads of questions, because I'm sure there will be things that I don't think of. So my name is Iain Jordan. I'm the clinical director at Clerkenwell Health. So I'm a psychiatrist by background. I've worked in the NHS and public health services in Ireland for the last 22 years now. And I left the NHS about a year ago to work with Clerkenwell Health. I loved what they were doing, and I loved the prospect of teaching a new generation of therapists and practitioners who are interested in new and improved treatments. And the reason I left the NHS really was kind of frustration with what I felt were the limitations of how mental health services are conceived of and run. And we realized after a little while of running trials at Clerkenwell that there are loads of training programs all over the world, 200, I think, at last count. But there were some gaps in the training programs we felt, from our point of view, that we could fill. One was that we felt that a lot of the training was focused just on therapists, but we're pluralistic, and we wanted to make sure that all different professional groups, whether they're delivering therapy or not, were included. So that's why the Foundations program is for any healthcare professional or any student who's training to be a healthcare professional. And then the certificate program, which is the follow-on, which will start later in the year, will be for, again, any healthcare professional, but this time people who are delivering therapy as part of their work. But that could be a nurse, could be a social worker, could be a doctor, could be a therapist. And the Foundations program is open to anybody who is just interested in understanding the state of the evidence, the proposed mechanisms, how psychedelic treatments might fit into the broader treatment landscape, and also thinking about what's happening around the world, what are the different movements toward legalization, what's happening in different countries. Australia has recently scheduled both psilocybin and MDMA as legal treatments for depression and PTSD. So as we see that, we'll see that evolve over the course of the next month and the next year. And the second gap that we identified was that there was a lot of excitement about psychedelics, and a lot of hype, and that's great. But there was less of an emphasis on the risks. So if these are going to be medical treatments for better or worse, people have different views on that. We thought, well, we really need to look at what's happening in terms of the risks that are being posed to people and the potential harms, so that we can best mitigate those. All medical treatments, every different type of treatment in healthcare has harms, and so we've really kind of focused in on that. We take a really unvarnished view of both the risks and the benefits, and we are taking very much a first principle scientific view. We're looking at the state of the evidence. We're looking at the emerging evidence of mechanisms of action. We're also thinking about the mechanisms of psychotherapy. What makes a good therapist? What makes good therapy? What are the change mechanisms? And how might those interact with the mechanisms of psychedelic treatments and related compounds like MDMA? And so I think we are unique in that we're very much kind of going back to basics. What are mental disorders? What is the current state of scientific thinking of how they arise, how they harden into syndromes, and how do we as healthcare practitioners support people to alleviate their symptoms and to move towards not just recovery, but towards thriving. So that was the background of why we did what we did. And we approached people from around the world who we thought were the best scientists and clinicians working in this field. I think people really liked where we were coming from, because everybody that we approached said that they would love to take part. So we have a really amazing group of people. I'm going to share my screen and just show you, for people who don't know, show you some of the people who have agreed to join us. So, oh, wrong way. So the tabs have all got all mixed up. So many of you will know the names of our lecturers. So we have Dr. Sarah Ty from the University of Manchester, who has long been involved in the world of psychedelic-assisted therapy. She was involved right in the early Compass manuals. You will likely have heard of Dr. David Arizzo from Imperial, who is one of the leading researchers in the world, and he's going to come and talk to us about his work on microdosing. So he did the seminal paper on microdosing, which was a citizen science project a couple of years ago. Dr. Roberta Murphy, who actually is one of our doctors on site, but also one of the most cited scientists. She has published papers on ethical frameworks for psychedelic medicines. Manoj Das from Johns Hopkins is a prominent neuroscientist, and really, I think, the clearest thinker when it comes to thinking about, what do psychedelics do in the brain, and how might those things that it does translate into recovery for people. David Luke, many of you will be familiar with, professor at Greenwich University and founder of Breaking Convention, which is happening this week, I believe. Taylor Greenstein, one of the most vocal critics of certain aspects of psychedelic treatments around the world. And she's going to come and talk to us about some of the harms that have come to patients, and particularly abuses by psychedelic practitioners, because, if we're going to be honest and ethical practitioners, we really need to have an eye on what are the things about these treatments that may lend themselves to abuse of vulnerable patients. So she's a wonderful person. Jacqueline Udell also has been instrumental in helping us design some of the philosophy around the course. She's a psychotherapist from the States, now living and working in the UK, and will be giving a talk that will be complementary to David Luke's, which will be thinking about, we're very much grounded in science and evidence and first principles. At the same time, we'll be encountering people who are having really extraordinary experiences, and sometimes, major spiritual or metaphysical shifts. And so we need to think about, how do we, on one hand, keep our feet firmly on the ground, and on the other hand, talk to patients and help them think about these kind of extraordinary shifts that are happening for them. And finally, Jules Evans from the Challenging Experiences Project. So Jules, one of the best writers on psychedelics in the world today. Some of you will know his Substack, Static Integration, and Jules very interested in challenging experiences that people have and how we can mitigate against those, how we can support people to go through them, and how we can turn those difficult experiences into transformational experiences. And then we have loads of lecturers from within Clerkenwell. So some of my colleagues speak. Dr. Sarah Bajot, who is a world-renowned psychologist and who designed the first iteration of our training program a couple of years ago, and now started up her own business that she supports us on the program, and she is also delivering 2 of our lectures. Dr. Adam Schumann, also one of my colleagues, who is a doctor of pharmaceutical medicine, and we'll be talking to you about all the kind of nitty-gritty details that he's more expert in than I am, about the effect of psychedelics on the body. And Ali Chadwick, who is a therapist, our lead therapist at Clerkenwell, and will be talking to you about patient experiences. So he will be the voice of the patient. He'll be the proxy for patients on our course. So that's a little bit about our speakers and the background for why we decided to run the course. I would love to, I'm sure there's loads of questions that you have that I haven't covered, so I would love to answer them questions. And then, Sophia, do you have, we have some questions coming in here. Fantastic. So, Jussi asks, is the foundation a prerequisite for the practitioner course, and do you consider it more than a medical clinical view? So yes, the foundations course serves two purposes. One is it can be just like foundational education in psychedelics for anybody who's interested, so any healthcare professional or any student who's interested, and it will also serve as the entry point into the certificate program. So it's two different things it can do. But yes, it's a prerequisite for the practitioner course. Practitioner course will be much smaller, of course, because it will, require, retreats and in-person sessions and one-to-one teaching. Whereas the foundations course is, we will have it all recorded and online, and there will be a learning journey on our learning management system. We try to make it as interactive and engaging as possible, but it's not as, scalable as, or the certificate course is not scalable. You've also asked about more than medical clinical view, such as indigenous settings and social impact. Well, we have two speakers that I didn't show on the page there because we haven't updated the page because they've agreed just very recently are Timmy and Felipe from the Psilocybin Access Network. I think that's right. And they are going to come and speak to us about access models for psychedelics. So, as I'm sure you guys know, the way we currently do psychedelic-assisted therapy is very expensive, and the people who need it most may be least likely to have access once it is legally, a medical treatment. And so we are very interested in ways of getting that to people, and that can include medical settings, non-medical settings, a group and individual settings within a medical context. So yeah, that's definitely something that we're very aware of and very focused on. So they're going to come and speak for us. Next question is from Charlotte. Wondering about the foundation course. Charlotte is wondering about the foundation course and then leading on to the practitioner course, how this will be regulated by therapeutic bodies. Will this qualification be useful for working with Clerkenwell? So that's a great question. So, as you all know, none of these medications or medicines are currently legal for use here, other than ketamine. We don't have a big focus on ketamine. So we make no promise to people that, they'll be able to be psychedelic-assisted therapists at the end, except in a research context. So if people get onto our certificate program and pass the certificate program, then they would definitely be fantastic candidates to deliver therapy at Clerkenwell. So we have 30 therapists at the moment delivering across our trials. But of course, until psychedelics are legal treatments, there isn't an accreditation pathway at the moment. But we are working with a number of different bodies to think about what that accreditation pathway will look like. So I hope in a year's time, depending on what the landscape looks like, hope to have an update for anybody on the course about that. I think nobody knows what that's going to look like just yet. Thank you for the question. Oliver, this from Hackney. If other colleagues would like to join, is there a cutoff date or this course will be available for a while? So the current plan is, launch date is 27th of May, and everything will be available online from that date. So the foundation course is about 30 hours of self-directed teaching. So some people might like to do that very quickly. Some people might choose to do it over, we're working full-time, might choose to do it over a number of weeks or months. But at the moment, there'll be no cutoff date for the course. So your colleagues or friends, spread the word, they'll be able to sign up at any time. We do have a number of early bird offers at the moment. So ultimately the course will cost £500 after launch date. But prior to that, there are various reductions that people can have access to. There also will be some free or reduced place spots for scholarships for those people who are unable to afford the fees. Next question is from Christine Gardner. And it just says, I'm a counsellor and I live in Rainham, Essex. So I don't see a question there. But let me have a look at the chat, see if there are any additional questions. Not so far. So
Iain, you can come back to the Q&A feature and there's new ones.
Okay, I have one from Lucy here. Can you share a little about the practicalities of the clinical trial, i.e. if you were working as a therapist, what hours, commitments? Thanks, Lucy. So it very much varies from trial to trial, therapist to therapist. So a couple of our therapists are full-time, like Ollie. So Ollie might work across 3 different trials and work, 5 days a week, quite long hours delivering on those trials. Some of our therapists are in, clinical practice elsewhere. And so they say to us, I can only do Mondays. And so when we book a patient in who can also do a Monday, we'll book them in with that therapist. And different trials have different requirements for how much therapist time there is. Typically, what it looks like is that, a therapist is assigned to a participant and the therapist meets them for an hour for somewhere between 1 and 3 weeks prior to dosing sessions. And then the dosing sessions themselves can range anywhere from 4 to 6 hours. So, for instance, for our methadone studies for PTSD, and methadone is very similar to MDMA, those are sort of 6+ hour therapy sessions. So very, very intense. But in terms of time commitments, it's really up to the therapists. They tell us when they're available. We have a pool of therapists, and then we call them up when we have someone suitable for them. We also are currently advertising for a full-time junior therapist post, and that person would then be able to would deliver, probably across a number of different trials. So we have 6 trials at the moment using various compounds: 5-MeO-DMT, methadone, psilocybin, and all of the therapy components of those studies all look very different. So thank you for that question. How does the online community learning get facilitated on the foundation course? So the foundation course, we are currently designing the community component to make sure that learners, even if there are a large number of them, are, have places that they can talk about what's happening on the course, can give us feedback directly, can, learn about new things. There, new articles coming in that are really relevant to what we're teaching people. So the design of what that will look like is to be decided, as is the, post-course engagement, so how we will stay in touch with people who've done the course and so on. That is not finalized yet. The practitioner course, that will be much clearer, right? So we will have retreats, we will have online one-to-ones, we will have groups and so on. But for the foundation course, because the numbers are likely to be higher, enough people from around the world, it's not likely to be in-person kind of groups on a regular basis. Also, links for the foundation program and early bird offers into the chat. Certainly, we will do that now. I have it open. Or actually, Zofia, if you don't mind sending that.
Yeah, just send it.
Great, thank you. Next question from Nathan. Do you have any sense of if or when it might become legal to offer treatments outside of research settings using these currently illegal medicines in the UK? So we, I can tell you what's happening and give you a kind of a best guess. So at the end of this year, the FDA is likely to come back with an initial view on licensing of MDMA for PTSD based on the phase 3 trials that were run by MAPS. And depending on the outcomes that there may then be a fast track for those for that to happen in the UK as well. So post Brexit, there's a mechanism by which it can happen quite quickly if the FDA says it's okay. So that would mean that if everything's super straightforward that they could be, say, for instance, early 2025. The complicating factor, I think, is that the FDA has never regulated therapy before. And so there's a big question mark over, how prescriptive are they going to be about what the therapy component is, and are they going to say it has to be MAPS now, like us, who provide the therapy training, etc. So bit of a question mark over that, but that will be the kind of fastest. And then for psilocybin, I think it's going to be a little bit longer until there's, sufficient evidence from phase 3 trials for them to say, for licensing bodies, whether it's MHRA in the UK or the FDA in the States, to say, yes, there's sufficient evidence. But again, there's the question about what is the therapy component. And there's this big debate in the field at the moment, which is first of all, is therapy necessary? And if not, is support necessary? And if not, how do we safeguard patients? And so there are trials ongoing at the moment that have no therapy, that have sort of psychological support, variously defined, and then studies that have the kind of non-directive approach, which is the kind of classic preparation, dosing, and integration model, and then studies that are using evidence-based models like ACT, CBT, psychodynamic therapy, and so on. And so we really are in the very early days of knowing what this is going to look like in 5-10 years. And it is likely to just continue to evolve as we go. So that is the kind of best guess I can give you for the timeline, but it's going to take a little bit of time. So it's likely to be the case that for the next year at least, the only place that these medications will be delivered will be in a research study in the UK at least. Slightly different in Canada and Switzerland. There's some provision for special cases, and in Australia, obviously, there's now this new legalization. So we're going to see what that looks like. Next question from Carolyn McHale. Will the practitioner course be held up north at any point? Well, hopefully, most of it will be online, so that this is for this certificate course. The foundation course is all online, so hopefully most of it will be online. And if there are retreats, you raise a great point. We haven't even got to teaching about yet, but yeah, that we should move it around. Next question from Charlotte. Could you please speak about the job opportunities when we continue onto the practitioner course and the diversity of locations for clients in clinical trials in the UK? So thanks, Charles. There are a few places around Ireland and the UK at the moment that are doing psychedelic trials and psychedelic-assisted therapy trials. Dublin, Belfast, Glasgow, Manchester, and a few different places in London. Clerkenwell is based in London, but we aim to open up a second site sometime in the near future. And obviously, there's a huge population of people around London, but there's another huge center of gravity, Birmingham and north of there. So if we want to be able to reach those people, that may be where we open up. But there are places around the country where these trials are being delivered, and so that's what kind of it looks like nationally at the moment. There is, again, as always, a center of gravity in London, but we hope that changes. Next question from it's on that one. On that one. I think any other appear at the top today. I think those are all the questions for just now. If anybody else has questions, you can stick them in the Q&A.
The Q&A tab, Iain, the new ones will show up.
Okay. Good thing to see us there. Is the therapist training following on immediately from the foundations course? And a practical question, can you give me a rough idea of how much the therapy course will cost? So it won't follow on immediately. We're very much focused on getting the foundations course online. It'll be some months after that. We don't have an exact date yet. And the price is approximately between £2,000 and £2,500 for the therapy practical training, and that will be 100 hours of teaching and in-person supervision, very practical. So if that is helpful. There is a course relating to supporting clients in psychedelic journeying at Exeter University. I'm wondering about the possibility of one working at Clerkenwell if one were to gain this practitioner course alternatively. So, yeah, I am aware of the Exeter University course. My understanding is, it is having spoken to people who have been through it, that it is kind of more sort of philosophically based rather than kind of, practitioner evidence-based. Believe. If I'm wrong, somebody, I've spoken to a couple of people who are doing it, a couple of doctors. Having done the Exeter course probably wouldn't make a huge difference in terms of a person's likelihood of getting a job as a therapist on a trial in Clerkenwell, because that is very much based on we do mock interview, mock scenarios for that. So it's very much a skills-based interview process. And we're less concerned about people's, seniority or number of qualifications and so on, more about their personal qualities as a therapist. And then also there's lots of training that has to happen after that then for a particular trial. So our course is quite custom made for that kind of journey, and that foundations provide a lot of the, academic or, scientific basis, and then the getting onto and passing the practitioner course is kind of custom made for what we do. So I hope that answers your question. Do you have any trials expected to take place within the NHS or in Scotland? Well, we personally don't, because our site is based in London, but there are psychedelic trials going on both within the NHS and Glasgow. A site in Glasgow has just opened for the meta loans for PTSD study. I don't know the name of the site off the top of my head. What benefits do you see the foundation training having for participants who are not in clinical roles that qualify for the practitioner specific training? If I'm understanding the question, I think that, so the foundations training would, so I think you're saying that if somebody wouldn't do the certificate because they're not practicing, what are the benefits of the foundations? Well, I do think that the foundations course is unique in that we are bringing in strands of thinking that I really do think are at the cutting edge in terms of, how to think about mental health problems, how to think about treatments, what's the relationship between the two, what is the future of treatment generally look like, and how does psychedelics fit into that? And I think that kind of broad base is unusual, and obviously I would say that work as the director of the program, but I think it is a type of education and a type of critical education. There's a lot of breathless kind of assertion about how psychedelics work and how well they work. That's just not backed up by the evidence. So it is really a kind of I think one of the few places where you can get a really clear, sober and realistic view of what the evidence is and what the issues are with the evidence space. So I think that is what people work at from it. That sounds like something that's interesting. Will people be required to have case studies on the certificate practitioner course? So not, it'll be very practical in that there'll be lots of simulated cases, but the vast majority of people won't have access to people undergoing psychedelic-assisted therapy, so they won't need to have practical cases from that point of view. The next question, how is data collected? I'm not sure what you mean by that, Christine, but if you want to elaborate, I'll be happy to answer. Are newly qualified CBT therapists eligible for the practitioner training post-foundation course? Yes, so anybody delivering therapy or anybody trained to deliver therapy, and so that could be anything from, people who have done relatively brief training and are delivering therapy in their job to people who've done 10 years of psychodynamic therapy will be eligible for the certificate course. So we are less concerned about years of experience or number of qualifications, and more concerned about the quality of people's therapeutic work. Is there anything else? I think there were questions in the chat, but I'll go back to. You mentioned the foundation course focuses on psychedelics and related compounds. What are these related compounds? So there's the second part of the question, but I'll answer that first part first. So when I say related compounds, I'm really talking about MDMA and methadone. So some people, when they say psychedelics, they mean classical psychedelics plus ketamine plus MDMA and methadone. So when I say psychedelics and related compounds, I mean classical psychedelics, MDMA and methadone, because those are the ones that are being researched with therapy. There is some research on ketamine. I know a lot of people do ketamine-assisted therapy. There's less research on ketamine-assisted therapy, but we will be talking about ketamine-assisted therapy as well, just not as much of a focus as we do on the others, because they are the ones that have gone through the most research. And then the second part of your question, where will the in-person intensives take place? How long are they? Are they residential? And can you say a little bit more about this component and what it entails? So I can't say much more about that because we haven't, because we're focused so much on getting 30 hours of online learning up that we haven't really sat down and thought about things like location and duration and so on. We'll have as much of it online as possible, and what we may do is what, for instance, the Mind Foundation in Germany do, and have like an online cohort and a in-person cohort, all to play for. What we don't know yet. And then, do you have an approximate idea when the practitioner course, and I think this means the certificate course, will be available? Well, we're going to get it up and ready as quick as we can after the foundation course launches. So hopefully by the end of the year. Well, as confidently I say by the end of the year, but I don't know how quick that will be after the foundations course. Is training as a psychological well-being practitioner sufficient to enroll in the practitioner course? So again, I think this is referring to the certificate course. So yeah, if you are delivering therapy, even so-called low-level therapy, as part of your job, then you will be eligible. I'm training as an end-of-life doula. Do you think there will be opportunities in the future for psychedelic-assisted therapy and end-of-life support? Yeah, I do. So I actually I will be delivering a talk on the training program about end-of-life care and psychedelic treatment. So I was a palliative care doctor in a former life, and I think that end-of-life care is sort of a perfect setting for these types of treatments, where you need dramatic and fast response quickly. And there is some really nice evidence coming out of that world. In fact, the European Union just funded the first psychedelic, it's the first time that they funded a psychedelic research, SciPal. So there's an awful lot of interest, and I presented at a palliative care meeting a few weeks ago, and there's loads of interest. So I think it's a patient group that I think I'm very excited about the prospects there. Do Clerkenwell trials so far back up the positive impact of utilizing trained therapists in outcomes? So we're not comparing trained therapists with something else at the moment. So I think it's too early to say, but it's a great point from Elizabeth. Until we compare psychedelic-assisted therapies to just psychedelics and compare trained therapists to, carefully chosen untrained, less trained people, and until we compare different types of therapy, so evidence-based therapy versus non-directive therapy versus, sort of support model, we won't know. But it's a fantastic question. I think this is one of the most exciting things about this is like, what's the minimum viable support for, people who don't need a lot of support? And then how do you personalize what the type of therapy is? I mean, I think there should be like a science of therapy rather than 345 different schools of therapy, which is how things work now. So, great question. And I think something that we go into quite a lot of detail on the course about is, elaborating on the question, looking at what the research from different areas of the world looks like. In the certificate course, you said there are 100 hours of teaching with in-person supervision. What will the in-person supervision consist of? Is there some form of experiential learning via participation in the research? Else, what is the supervision about? Okay, so this will be, yes, experiential learning, but no, it won't be with people taking psychedelics, because there's no setting to do that outside of clinical trials. But it will be, it's likely to be not so much supervision, but rather group discussions, simulated cases, and then maybe some supervision of cases that people are bringing from outside, where we could think about, how and why and in what way psychedelics might complement that. Next question from Victoria. I'm only aware of one other training available in the UK, which is the Institute of Psychedelic Therapy in London. Would you mind elaborating any differences and advantages? I don't know that course in detail, I'm afraid, Victoria, so I can't comment on that one. If you have any additional information you could share, I can try and answer. Next, Sophia. Karen asked earlier, how academic do you need to be to do the course? Are there written assignments that are marked? Well, I think, we go into some depth into some fairly, into some new ideas that, that can be complex. We don't go into massive sort of academic depths. But these are novel ideas, I think. I don't think you have to be particularly academic. I think these are ideas that will be understandable to anybody. There is some level of understanding required if you want to get onto the certificate course. Don't be a pass mark, but people for whom that's not terribly interesting can just get a certificate of completion, and they've done the course, and they don't have to go through the rigmarole of gaining a passing mark, so on. Next question. Will there be options to, via the course, participate in part of the research? Well, the people who do the certificate course will be very well placed to deliver therapy on our trials, and we'd know them really well right then, and so that would be almost like an extended interview. But we wouldn't be able to guarantee anything. It wouldn't, there would need to be places, but we do aim to kind of scale up. And so we're going to have more sites, and so we're going to need more therapists. So yes, I think is the short answer. With some caveats. So from Alex, are different type of therapists more sought after for current trials? For instance, would a high intensity CBT therapist be preferred over a PWP trained low intensity CBT? Again, it depends on the study. So for some of our studies, there's no preference at all. People just need to have, have seen X number of patients or have, the 3 years of experience, say. For other studies, so for instance, we're running a study for alcohol use disorder and 5-MeO-DMT, which uses motivation interviewing and CBT. And so experience in CBT is certainly desirable for the CBT part, but it just, in your example, Alex, it says CBT high intensity or low intensity CBT. I think both of those people would be eligible to apply for that role. And then we do have an ACT, so acceptance and commitment study coming up in the future, and we would certainly prefer people who've done ACT, but we'll also be training people in ACT for that study as well. And so I hope that answers your question. Dan says, are we in the UK legally allowed to advertise and take clients to Holland for talk therapy? Well, that sounds complicated legally. I would speak to your accrediting body, your governing body, because I think the advertising part would be potentially risky, even though you're advertising something that is happening abroad, and taking a client elsewhere. This is actually something that's come up because I do advise it's not a psychedelic organization, but it's an organization that brings people away for retreats that are to various far-flung places in the world, and those retreats are, aim to be transformational, but the legal logistics of bringing somebody abroad are high enough if you're just a travel agency. But if you're a professional acting in a professional capacity, the person is potentially vulnerable. The legal and insurance stuff that is required is extremely complicated. So I would say proceed with caution and certainly speak to your governing body. Clinical trials. Well, here Christine is elaborating. Clinical trials collect data. How is the data being collected? By the therapist? Are there forms, questions, data points that need to be addressed? Yeah, so there are multiple ways of collecting data. So at every time we speak to a participant, which is dozens of times over the course of the trial, we collect data. So that's data on adverse events, which are recorded contemporaneously. At every scheduled visit, we also do a number of different data recording exercises. So sometimes those are structured interviews, sometimes those are kind of safety checklists. Anytime a therapist sees the person and has any concern, they'll come to me and I'll document whatever their concerns are. And then participants can phone us at any time and give us information, which again gets documented and becomes part of the record of this file. So yeah, lots of different ways, lots of forms, lots of questions, lots of tick boxes, and lots of primary and secondary outcome measures and lots of safety assessments. Will the foundation course account for CPD hours? So yes, in the sense that you don't need to really do anything in the UK. You just need to say, I've done this course and it counts as CPD. We are seeking accreditation for CPD, so that will be endorsed by various governing bodies. So the VACP, GMC, etc., but not formally accredited yet. But that won't stop anyone from claiming a CPD. So clarification, someone after doing the Foundation Programme Qualified Certificate course, we will be able to apply for a job within Clerkenwell Clinical Trials. Will there be utility from the qualifications aside from working for Clerkenwell? So you can apply for a role at Clerkenwell delivering on a trial now. You don't need to have done the course. But people who have done the course, they will be they're people we know. We're saying they're great therapists, and they will then form a pool of people that we can contact when we of the upcoming trials. The utility of the qualifications, well, it's educational at the moment. So for the foundations course, it's really to like understand what's going on in the landscape and to have what we say is the best and most up-to-date training. The certificate course would serve a similar purpose, so training and education, and then also, as I say, the people who've done that course would be then part of our kind of therapist community. It's sort of an inner sanctum of the therapist community, and we would hope would then go on to deliver trials. You said you have, so from Christine again, you said you have 6 trials. They run at Clerkenwell. How many clients are on these trials? How many clients are on the trials? Well, I can tell you that what our recruitment goals are for the 6 trials. So yeah, that's all at Clerkenwell. And my estimate of the recruitment goals for those different, I think we've 5 live, 4 or 5 live, 2 more coming up. Recruitment goals are in the region of 60 in total, let's say, and we've probably done 20, maybe some more like 70, and we've seen maybe 30-ish of those so far this year. So that's the kind of ballpark. We have different recruitment targets, for different studies. Question from Charlotte. Please, can you tell me if the foundation course is live or are there use of recorded lectures? Yeah, so the foundation course is all online learning. So 30 hours of a combination of, lectures, talks, interviews, and then the learning journey also incorporates reflective questions and multiple choice questions and exercises, and there will also be a community component where people can discuss and talk about, reflect, and give us feedback. Next question from Astrid. Where do you get the funding from Clerkenwell? Well, great question. We have investors, but we also we are paid by sponsors to run trials. We also have different arms of the business that do different types of business, and so revenue comes in for those. Jan, does one need a work permit from the UK to participate in the trials after the training? Yeah, so anybody working in the UK would need to have a work permit to work in the UK. In some cases, so for instance, if we're recruiting permanent members of staff, we sponsor them for visas. Yeah, generally speaking, those are contractors, so they would need a work permit. How much will knowledge and information be taken for other countries, for example, Australia, USA, with all the work you're doing there with so many less restrictions to add to the course? From Adam. So there's nothing about this course that is like location specific, if I'm understanding your question right. So this is the course draws on research from around the world. We do have some talks that are kind of location specific. So we'll be talking about the emerging Australian model. We'll be alluding to Switzerland and Canada and the work they're doing there. But there's nothing about the academic scientific content that is location specific. So all of the knowledge that you gain from the course will be relevant wherever you work. Please, can I ask where Clerkenwell advertised for therapists supposed to support clinical trials? So a number of different places. So they will appear on the website. They will appear in our newsletter. So if you're interested in signing for the newsletter as a practitioner, if you go to our website, and if you up at the top it says for therapists, and if you click on that, you can sign up for the newsletter where you will get updates whenever we're recruiting for trials, and we'll send or recruiting for staff, we'll send that information out. And then if you follow us on LinkedIn and Instagram, we'll also post updates and job ads there as well. Next question again from Victoria. Perhaps I'm thinking too far ahead, but I just want to check, do I need to maintain my professional accreditation to work on trials as a high intensity therapist? You would certainly, to deliver therapy in any context, you would certainly need to be a licensed therapist. So with whichever licensing body you're registered with, a registration, professional registration is a requirement to deliver either clinically or in trials. I think that answers your question. From Justin, why have you decided to open a course to the public now? Good question, Justin. Well, we've always wanted to do this, and we've been working hard to get all the lectures that we wanted, and Zofia is funneling questions to me there. Has been doing amazing work on the kind of on the structure and on the infrastructure and the technology to get this out to people. So we've always wanted to do it, and this was the time when we kind of got around to getting everything to the point where we're like, we're launching in a month, and here's what it looks like. And the reason that we've done the foundations course, in addition to the certificate, which is the sort of practical training, is because I think that there's just a much broader group of people, healthcare professionals and students who are interested in this, and we thought that there was information out there that they weren't getting, and so this is for them. The next question from Jan. I would be interested if the training would also cover the Oregon requirements for 120 hours of training. I'm not aware of that. If you want to share anything, that would help us, because that sounds like something that would be very interesting to think about. I'm not aware of that specific requirement. So if you have anything else, I would love to hear it. Just going to reload the Q&A here. Is there anything else? 3. I think that is all the questions for just now. Is there anything else? How then we have 6 minutes. Oregon Psilocybin Board has specific requirements for offering psilocybin. Yeah, okay, great. Thank you. I'll look into that, because that is it's a great question. I don't know the answer. Next question from Olivia. From your perspective, what is the current view within the NHS about psychedelic-assisted therapy? I realize there are trials happening within the NHS, but I also hear a lot of skepticism. Yeah, I think it's highly variable. I suspect that the people on this call are a little bit like me, right? In that, you're really interested in this area. I'm no evangelist, but I do think it's exciting. As much for the brilliant people it is attracting to mental health as for the actual, the thing itself. But what I realized when I go and speak to people who aren't in this area, there's huge variability. Some people haven't heard of it. Even healthcare professionals, some people have vaguely heard of it, and some people are skeptical. Some people just have preconceptions. I'm 46, and I, when I was in my late teens, Leah Betts had just died, while she was taking ecstasy, and so there's a whole generation of, and then there are other people who, heard horror stories about LSD. There's a whole generation of people who, for whom these medications have been kind of vilified. And sometimes that's poorly informed reporting that leads to that. So I think it's highly variable. Yeah, I think it's a great question. We're going to be encouraging people when they come on the Foundations course to talk to their colleagues about these issues, because I think you'll learn loads of new things, and those are things you did not learn in your professional training as well. I think it'll be exciting for you to go and debate with your colleagues, and that might be saying, these are transformational and these are going to change the world. Or it might be saying, oh, a lot of the information out there isn't good, even the hype, all that stuff. So I think it'll be a very exciting and stimulating time. Yes, people on the course. Next question. Are you, Iain, the principal investigator on the trials? No, so I'm clinical director, so I'm the senior doctor in Clerkenwell, but typically the trials have, principal investigators who are elsewhere, so different for different trials, but and let's just be in the future. Apart from being a qualified counselor therapist for this typical course, what else would be required to get onto the course? Nothing at all. So you're a healthcare professional, or you're a student delivering, who is delivering therapies or the training, and you do an assessment, and we'll pick the very best people who do the assessment of therapy skills. Excuse me. Sorry, I'm coughing. Yeah, the recording of the session will be available, excuse me, online very soon. From Fiona, how much therapy do you generally offer on your trial? It very much depends on the protocol. Different protocols have different intensities of therapy. So sometimes people will meet their therapist for 3 weekly hour-long sessions, then they'll have 4, 6-hour therapy sessions, successive weeks. Then some integration sessions, and they're done. So it's a huge amount, really, 40 hours maybe in total, and some are quite a bit shorter, and so more brief and focused interventions. So it's very variable. I'm going to just a final question from John. Will there be an installment option for payment for this typical program? Yes, there will be an installment option for payment. And there will also be a small number of places for scholarships for people who aren't able to afford the tuition fee. So I think that we should probably wrap up because it is 1 minute to 6. Thank you everyone for fantastic questions, and thank you for giving up an hour of your Wednesday evening to come and talk about this. If people have other questions, there's a form on the website. We hopefully we've answered everything. We'll put this recording up as well. We would be very grateful if you share it with other people that you may be interested in. Sophia has just shared the website there at the bottom. And well, we look forward to seeing you all online on the 27th of May, hopefully. And if there's anything we can help you with in the meantime, please do let us know.